Today I'm going to show you how I perform a platelet lysate epidural injection. An epidural injection is used to treat back pain, sciatica, and stenosis. And basically I'm going to be injecting platelet lysate, which is made from your PRP, into the spine, and that's going to cover all the nerves, all the discs, and all the internal structures. And what that's going to do is going to decrease nerve inflammation, any nerve pain. It's going to decrease inflammation of the discs, and it's going to stimulate a healing process. The caudal epidural that we use is basically a simple injection through a little opening in the tailbone right here, and then the platelet lysate is going to spread up and it's going to cover all the nerves, all the discs, and all the internal structures. There are other approaches to do epidurals. You can get an intralaminar epidural where you inject in between the vertebrae, or you can get a transforaminal epidural where you inject from the side around that nerve. And all of these injections basically put the medication or the lysate around the nerves to decrease nerve inflammation. We are going to do the caudal epidural. That is the most simple, and it's also the safest approach, and it's very effective as it covers all the structures that we need. This is the platelet lysate that we're going to use to inject this patient. The platelet lysate is made from platelet-rich plasma that's further processed, and then the growth factors are released. This patient has degenerative discs and has a disc tear, so we're going to do the caudal epidural with the platelet lysate, and it's going to spread around his nerves and around the disc, and it's going to help him with the pain, and it's going to help the disc heal a little bit. First, I'm going to identify the entry point with the ultrasound on his sacrum. Here's going to be my entry point right there. That's where we're going to numb up the area, and that's where we're going to put the injection in to spread the platelet lysate into his spine. I'm going to clean the area with sterilizing solution. This is the same type of solution that's being used for surgeries. It makes sure that the skin has no bacteria and no other contaminants. So I'm setting up a sterile field to make sure that the whole procedure is sterile. We're going to numb up the area, a little poke. So I'm going to go ahead and insert the needle to start the epidural injection. You can see the needle right in the midline. Go ahead and make sure we withdraw there's no blood. Go ahead and put on a Doppler. So the needle is in the little opening in the tailbone, and I'm injecting the platelet lysate right now, and you can actually see the flow on the color Doppler. And basically the lysate is going up from the tailbone up to the spine, up to the L5-S1 disc where his injury is. And that will decrease the inflammation of the nerves, it will decrease the inflammation of the disc, and it will make him feel a bit better. So we're done with the caudal epidural injection. The platelet lysate traveled from the tailbone all the way to the spine. It's going to cover his disc and his nerves, and it's going to decrease the inflammation of those nerves, and it's going to help him decrease the symptoms such as the numbness and the pain. The lysate also has some growth factors in it, and that will increase the healing of the nerves and healing of the disc. And this will hopefully give us long-term results.